I'm Dr. Eric Waldon, Associate Professor of Music Therapy at University of the Pacific in Stockton and San Francisco, California. This presentation is about looking at where assessment fits into the music therapy treatment process. As far as learning objectives go, we're going to talk about something known as the database decision-making model and what that is and its characteristics. And one of those characteristics are different methods that are used in collecting assessment data. You'll understand what the acronym RIOT stands for. We'll also see how database methods are used at different stages of treatment, and we'll also go over the different treatment stages. And then how assessment and these database methods fit into the larger picture of the treatment process. Let's talk about a database model first. Database decision making, or what I refer to as DBDM, in music therapy involves an ongoing process of both collecting and analyzing information to inform important treatment decisions. And there are three characteristics of a database model. The first is that it's multi-method. Secondly is that data collection is ongoing. And then finally, the data is used cyclically. So as you're making clinical decisions, the data is what drives the process forward, but in some cases the data may suggest a return to an earlier stage of the assessment process and treatment. So let's look at these multi-methods that I've been referring to. Whether it's research or it's clinical practice, there are four ways that we can go about collecting data. We can review things like medical records, school files, work samples, songs that have been written. We can review research. The second one is interviewing. So we may be interviewing our clients, parents, other family members, significant others, physicians, nurses. The third method is observing, whether those are systematic observations, things like frequency counts or looking at antecedent behaviors and consequence chains. Observations can be more descriptive, maybe less structured, and we can also conduct observations across different environments. And then the fourth is testing or measuring, and this involves collecting some sort of quantitative representation of a construct or a behavior or a response. Sometimes we use very discipline-specific tools. We might be looking at test data from other disciplines, maybe physical therapy, speech-language pathology, psychology, but there are also music-based measures as well. And testing can also involve, or measuring can also involve physiologic measures, heart rate, blood pressure, respirations, things like that. So let's take a medical setting as an example, and take just a moment, and you can pause the video if you wish, but I want you to think about what types of things might you review, that's the R, in a medical setting as far as assessment goes. You might have been thinking about medical records, looking at discharge plans, but also looking at research evidence. Reviewing does involve looking at the research evidence from scientific papers, maybe from textbooks, monographs, journals. So that's the review part. Now take a moment, pause the video if you need to. Think about people you might interview in a clinical setting, in a medical setting. I'm sure you thought of others, but people that you may want to interview in a medical setting include the patient himself or herself, their family, their friends, significant others. But there's also value in interviewing physicians or nurses, social workers, talking to specialized care staff, perhaps chaplains, speech-language pathologists, physical therapists, or a certified child life specialist. That's what a CCLS is. Do the same thing. Think about where you might conduct observations and what you might observe in a medical setting that would be pertinent to assessment. Some things you may have come up with are different environments. Perhaps it might be important to observe someone in the hospital room. Perhaps there's more of a public area where you could observe them. And maybe looking at nonverbal behaviors. I often know that when patients are experiencing a great deal of pain, they may not verbalize it to you, but there are other things that you can pick up on that may suggest that they're in pain. Whether it's facial expression, grimacing, for example. And I know some people will position their body in a way that looks very uncomfortable to us as an observer, but it may be a position where they're actually alleviating pain in a particular area of the body. We can also infer some things about a particular person's emotional state based on some of the nonverbal things that we're observing. And finally, think about tests and measures in a medical setting. So in addition to maybe physiologic measures like a heart rate, blood pressure, we may have pain or physical discomfort scales. A popular one is the Wong-Baker FACES scale for pain. We may have a relaxation scale. As far as scales go in a medical setting, I like to use the ones that are already being used within the medical facility. That way, you're not having to reinvent something or reintroduce something. If it's already kind of part of the ecology of the medical setting, it's so much the better. It also provides, there may be archival evidence within the person's medical record, so we can track these measures over time. And a couple music therapy specific measures which may be relevant to medical settings include the Matadoc and also Kimpac and Massa, which are both used with children. So another characteristic of a database model of assessment in music therapy is this ongoing characteristic. So in music therapy, we're constantly collecting, we're constantly assessing. And this is a treatment process that's outlined. It's based loosely on the American Music Therapy Association standards of clinical practice. And it starts with referral, and then it moves down through termination. And under each one of these headings are different tasks or goals that occur during each one of these general stages of the treatment process. And so one may ask, well, where does all this data, where is it all collected? And what I like to think of is that reviewing, interviewing, observing, and testing occurs across all of these. At some point across all of these different treatment stages, you are using RIONT, reviewing, interviewing, observing, and testing. And this all informs the treatment process, it propels it forward, and these multiple methods can be used in making decisions along this treatment process. We can go a little bit further into it. If you're thinking about referral as a first stage, you want to consider what types of information is needed for you to make a determination as to whether or not someone is appropriate for music therapy. So think in terms of what records might you need to review, who might you need to interview, are there observations that are pertinent, or are there any testing or other measures that you would use in making that referral decision. The initial intake, this is sometimes what people refer to as the assessment. But when you have accepted a client for music therapy treatment, consider again the 4 different types of methods involved in a database approach, reviewing, interviewing, observing, and testing, and how all of those methods can be used as a way to answer some of these questions, like what are the client's strengths and needs, what type of interventions may be most appropriate, what background information is important and may be relevant, and how you can get at that information through reviewing and interviewing in particular. Planning involves formulating those goals and objectives and coming up with a preliminary treatment plan. Again, think about reviewing, interviewing, observing, and testing, R, I, O, and T, and what role do those different methods of assessment play in the planning stages. One area that I will always emphasize is, well, reviewing that relevant research and clinical literature. That is an important part of determining what it is that we're going to do, whether we're looking at systematic reviews, if we're looking at meta-analyses, if we're looking at what the research evidence suggests is the most appropriate form of treatment. Implementing treatment is all about progress monitoring and monitoring the response to a particular intervention. We can use interviews as a way to gauge someone's responsiveness, what their thoughts and perceptions are about treatment. We can conduct observations, we can collect measures or tests, and then if we are intervening on a behavior or response that is occurring outside of the music therapy session, perhaps these are things that are going on in other locations within a hospital or in a facility, reviewing records can be an excellent way of monitoring someone's response, or we can make some inferences about how they are doing in response to or as a function of them participating in music therapy. And so what we're doing is relying on other disciplines and our colleagues and their documentation to determine any changes in our treatment plan, but also their response to our intervention. Termination, obviously this occurs towards the end of treatment when goals and objectives have been met, or when you've made a determination that treatment's no longer beneficial. And when termination is being considered, you always need some sort of data to support the termination is appropriate. And again, what we do is we go back and we look at the data we've collected through reviewing, interviewing, observing, and testing to see if a termination or an end of treatment is justified, or perhaps the data will suggest that treatment needs to continue. Termination also involves creating a discharge plan or an aftercare plan, and we would also want the data to suggest that yes, ongoing treatment, but maybe of a less intense nature, maybe outpatient, etc., would be appropriate. And we would use that data as a way to support a discharge or a termination plan. Another characteristic of a database decision-making model is this idea of cyclical decision-making. And this is based on kind of a positive feedback loop, where, as you can see, if we start with referral up here at the top, if you're collecting data through reviewing, interviewing, observing, and testing, then that may suggest moving on to the first stage of intake. And so the data is always driving the process forward. Okay, and again, reviewing, interviewing, observing, and testing occurring at all stages of the treatment process. But let's say that during the implementation stage, you're noticing that you're not seeing the response that is predicted. That may necessitate you looking at the data you're collecting through reviewing, interviewing, observing, and testing, taking a look at it, and perhaps it would result in you needing to re-examine, so going back and looking at some of the goals and objectives, or maybe even examining the course of treatment that they're currently receiving. We don't make these decisions arbitrarily. We don't say to ourselves, well, I don't think this is working. We look at the data and then we determine, oh, I think a change needs to be made. So the cyclical idea is that the data is always suggesting whether or not we return to an earlier stage, and also suggests whether or not we can move forward with the current course of treatment. So it's all based on some sort of data. I should also point out at this stage, if you haven't figured it out already, data doesn't just mean numbers. Data involves observations of what it is that we're seeing, hearing, and also hearing what they're saying, the stories that they're telling us, the work that they're producing. So it's not, data is not simply numeric. Then finally, as we put it all together, what is the role of assessment in treatment across all these stages? So again, we look at that database model that we have here. And if we think about the different purposes of assessment, if we look at the first three stages of the database model, well, these three stages are involved in either diagnostic assessment or in prescriptive. So diagnostic is when a music therapist is working as part of a treatment team, and they may be collecting data, the goal of which is to help the treatment team come up with a diagnosis, or prescriptive, where the music therapist is collecting data, so reviewing, interviewing, observing, and testing, as a way to plan treatment. Coming up, identifying things like goals and objectives, identifying their preferences, their strengths, their needs. And then formative assessment is occurring during the implementation stage of treatment, where we're monitoring progress and we're constantly using reviewing, interviewing, observing, and testing as a way to determine whether or not goals and objectives are being met. And then the termination stage, which is really more summative assessment. We're determining whether or not they're no longer benefiting from treatment, if they've met their goals and objectives, and also determining whether or not a follow-up or discharge plan may be necessary. And that's coming about through summative assessment. And again, we're looking at a review of records or a review of documents, interviewing the client, doing observations, and then collecting quantitative measures through testing. That concludes this presentation. Here are some references. If you do have any questions, please don't hesitate to contact me. My contact information is available through the MTAC website. Thanks.